The real difference between calcium and vitamin D for osteoporosis. Osteoporosis is a disease that leads to a decrease in bone density and quality, making bones fragile and significantly increasing the risk of fractures. It is often called a silent disease because bone loss occurs without symptoms, and the first sign is frequently a broken bone, typically in the hip, spine, or wrist. The clinical significance of osteoporosis is profound. It is estimated that an osteoporotic fracture occurs every 3 seconds globally, leading to over 8.9 million fractures annually. These fractures can cause chronic pain, disability, loss of independence, and are associated with premature mortality, especially in the case of hip fractures. Maintaining bone health throughout life is crucial, and adequate nutrition is a primary modifiable factor in this fight. Calcium, the building block of your bones. Calcium is a mineral that is essential for life. About 99% of the body's calcium is stored in our bones and teeth, where it provides structural strength and hardness. Think of calcium as the primary building block or brick that gives your skeleton its density and rigidity. Every day, we lose calcium through our skin, nails, hair, sweat, and other bodily processes. Since our bodies cannot produce calcium, we must replenish it through our diet. When dietary intake is insufficient, the body is forced to withdraw calcium from the bones to maintain vital functions in the blood and cells. Over time, this imbalance causes bones to become weak and porous. Vitamin D, the master key to calcium absorption. If calcium is the building block, then vitamin D acts as the master key that unlocks the door for calcium to be used effectively. Vitamin D's most critical role is to facilitate the absorption of calcium from the food you eat in your intestines. Without sufficient vitamin D, your body cannot absorb enough calcium, regardless of how much you consume. This deficiency triggers a chain reaction. Low calcium levels in the blood lead to secondary hyperparathyroidism, a condition where the parathyroid hormone, PTH, becomes elevated. High PTH then attempts to correct blood calcium by leaching it directly from your bones, accelerating bone loss and increasing fracture risk. Furthermore, vitamin D is crucial for muscle function, and its deficiency can increase the risk of falls, which are a major cause of fractures in people with osteoporosis. Why do you need both? While they have distinct jobs, calcium and vitamin D form a synergistic partnership that is essential for bone health. The combination is far more effective than either nutrient alone. Combined supplementation is more effective. A 2023 review highlighted that calcium with concomitant vitamin D supplementation leads to an increase in bone mineral density, BMD, whereas vitamin D alone does not. Furthermore, major meta-analyses have consistently shown that the combination of calcium and vitamin D significantly reduces the risk of fractures. One such analysis showed a 15% reduction in total fractures and a 30% reduction in hip fractures. Another concluded that combined supplementation reduced hip fracture risk by 16%. Support for medications. For patients prescribed osteoporosis drugs, adequate calcium and vitamin D intake is non-negotiable. These medications have been proven to reduce fracture risk in clinical trials where patients were also receiving calcium and vitamin D, meaning their efficacy is predicated on the presence of these essential nutrients. Sources and supplementation tips. Calcium-rich foods, dairy products, milk, yogurt, cheese, certain green vegetables, collard greens, broccoli rabe, canned fish with bones, sardines, salmon, and fortified foods. Vitamin D sources, fatty fish, salmon, tuna, fortified milk and dairy alternatives, and exposure to sunlight. However, due to modern lifestyles and sunscreen use, deficiency is common, making supplementation often necessary. When choosing supplements, calcium. The two most common forms are calcium carbonate, should be taken with food, and calcium citrate, can be taken with or without food. For best absorption, take no more than 500 to 600 milligrams at a time. Vitamin D. The two main types are D2, ergocalciferol, and D3, cholecalciferol. Both are effective for bone health, with D3 being the form naturally produced by the skin. Important: always consult with your healthcare provider before starting any new supplement regimen to determine the right dosage and type for your specific health needs. Conclusion: the difference between calcium and vitamin D in the fight against osteoporosis is clear. Calcium is the fundamental mineral that builds a strong bone matrix, while vitamin D is the crucial regulator that ensures your body can absorb and use that calcium effectively. One cannot perform optimally without the other.